Good morning, everyone. Welcome to the Children's Mental Health Matters webinar series. I'm Angie McRae. I'm the Child and Family Engagement Manager here. Today's session is being recorded and will be made available to you in the coming week. Our speaker today, Jenny Ryan, is from Backpack Health, and she'll be covering suicide prevention for educators, mental health professionals, and parents. So let me tell you a little bit about Jenny. Jenny Ryan is the Chief Clinical Innovation Officer at Backpack Healthcare, a pediatric mental health provider offering therapy, psychiatry, and innovative care solutions for youth and families. With a background in clinical social work and a passion for workforce development, Jenny has designed evidence-based programs that support both preventative care and crisis intervention. She brings over a decade of experience working directly with children, caregivers, and schools, with a specialization in treating children with autism, intellectual, and developmental disabilities. Jenny, I'll turn it over to you now.
Thanks so much. Welcome, everyone. Really excited to be meeting with each of you, hoping to give some great information on suicide prevention, especially where it comes with children and adolescents. I'd love to know a little bit more about who's in the room. I see we have someone here from Montgomery County Public Schools, from DXT Therapeutic Services, as well as the American Academy of Pediatrics. Love to know if we have any parents in the audience today, any other practitioners, to make sure that the information that we're sharing is really curtailed to you all. So pop into the chat, say hello, where you are tuning in from, whether you're a parent or an educator, a mental health professional, and welcome. I'm Jenny Ryan. I've been working in Maryland for my entire career, and really excited to talk with you all a little bit. I wanted to go through some of our goals here, really being able to recognize suicide warning signs, be able to all be on the same page about what is suicide, what does it look like, and really dig into what does it look like for age specific indicators. We know that young children, it may look different than our teenagers and our young adults, and really being able to understand how to respond with confidence is really important. There's a lot of resources within our community and making sure we know how to get connected, but what to do in the meantime as we're trying to navigate those systems is extremely important. It's a lot on our plate with all of our job responsibilities for our educators and our mental health professionals. When something like a crisis comes up, it is easy to freeze up, not know what the next steps are. And so, in my time of workforce development, working with licensed master social workers and other mental health professionals, as well as educators, it's really about being prepared, being able to know what to do, practicing what to do ahead of time. Very much so like that fire drill that we did, back in elementary school. Knowing how to operate really helps us make sure we're confident when those things come up, because we all know that they do. Awesome. I do want to put a reminder out that this is a safe space. There are great questions that will help to improve everyone's understanding. Don't hesitate to speak up. Raise your hand, unmute, ask your question, put it in the chat. I want this to be a really interactive workshop. I don't want to be talking the entire time. I want to hear from you all and learn from you all. I'm a big proponent that we want to make sure that we're treating this as a sensitive topic. If you need to take a step away, please do so. Mute the computer, take a step away if you need, and come back when you're ready. It's really, something that we want to make sure we're ready for this conversation, and be present. It's not going to be perfect, but just being here to listen, learn, and understand how to support each other is impactful. I want to take a second to have everyone put into the chat, how are you arriving today? What's one word that describes how you are doing today as you're showing up for this conversation? I'll give everyone a minute and pop it in the chat. Content. Curious, eager, encouraged, open, excited but tired. I definitely woke up thinking it was Friday, um, but it is not. Great, wonderful. All right. So let's dig in a little bit. Let's talk about just to begin with, what is suicide? These are terms that many of us have learned in school, have maybe dealt with, at work, had children come up to them and say these things. So suicide is the act of intentionally taking one's life. It's a tragic outcome, and we are working to have a lot of prevention efforts to have impact to prevent this from happening overall. But suicide is the actual act of taking one's life. A suicide attempt is a non-fatal self-directed behavior with the intent to die. We know that immediate intervention is really required. And then ideations. There's two type of ideations. Does anybody know the two types? There's Let's see if anyone pops into the chat. There we go. Passive and active. We know that both are extremely important to pay attention to. Passive ideations really mean that there are wishes to have a suicide attempt, discontent. We'll talk through a little bit about what that looks like in different ages. And active means that there is a active plan, timing, all of the things that go into immediate intervention being needed. So both are extremely important, but we handled them a little bit differently for passive versus active ideation. Active ideation is really, hey, we need to get a psychiatric hold potentially. We need to, put into efforts to address that immediately. Passive is the opportunity to work really heavily on our prevention, be able to put in a lot of the skills that we'll touch on a little bit later. There are a lot of myths that come up with suicidal ideation and suicide prevention. We are a lot of times told that if you talk about suicide, it is more likely that a child, young adult, might attempt suicide. In fact, that's a myth. Talking about suicide opens up a space for being able to talk about how we're feeling. It even reduces the risk of that isolation, and opens up a conversation to begin trying to treat whatever might be going behind the scenes for that individual, and gives us an opportunity to have direct questions for those life-saving measures. We know that a lot of us will do a patient health questionnaire, the PHQ-9, where it asks very pointed questions. That is allowing us to understand exactly what is going on with the individual that we're talking to. It is okay to ask, do you have a plan for attempting suicide or committing suicide? Those are things that will come up, and we have to know exactly what we're going to be asking to the individual and feel comfortable with that, but knowing what to do with the answer as well. I've seen in so many circumstances that we know the questions to ask, but we don't know how to react to the answers that we're getting. And that is where some of the practice comes into place. So if a student comes and tells you, I have a plan, I have an intent to do so, now what is the question? And a lot of times we freeze up here because we don't know the next step to take in order to continue working with that student or child. Most people do give warning signs, and it looks a little bit different depending on age. So it's important to understand that getting to know any nuances and changes of behaviors is a big component of being able to continue understanding what those warning signs might be for the individual directly. And even young children have these thoughts. I know that, there's been some young children that I've worked with that have even expressed, I don't want to be here anymore. They might use different terminology than those with maybe more vocabulary, but even young children are having these thoughts. So I talked a little bit about warning signs. This digs a little bit deeper. Uh, there's a few different ways that we see this show up, including verbal indicators, so expressing direct feelings of being a burden, not wanting to be here, having no reason to live. Some of these may be a direct, I want to die, and others might be, I don't feel worthy, or don't really feel like doing anything. Some can be more vague of an ideation or verbal indicator there. Behavioral changes, especially with children, are one of the biggest indicators. Withdrawing from friend groups, activities, sports, maybe they love art, not doing those things that they love to do, is an indicator that something is going on with that child. We might also see an increase of risky behaviors for our teenagers. We know when we start to not think about the consequence or not care about the consequences that are coming. One of those, warning signs could be pointing towards suicidal ideations. Emotional shifts, impulsivity, mood swings, overwhelming, guilty feelings or shame, as well as anxiety, persistent hopelessness. So we know we're seeing this a lot with our adolescents, and at increasing rates, unfortunately, that we're seeing these, persistent feelings coming up. And routine disruption is the fourth. So significant changes in sleeping, eating, daily activities, going to school, completing responsibilities, going to work if we're a young adult, engaging in our typical day-to-day routine, can be a cause for concern. I want to pause here. Are there other warning signs that you have seen? Any questions that you have about what these warning signs look like? Awesome. I want to dig a little bit further into age-specific risk factors. Obviously, vocabulary ranges for youth, and being able to see some of the behavioral indicators for our younger kids is necessary. So, with our maybe elementary, middle schoolers, even younger than that, maybe pre-K, being able to see what's happening with them physically is an indicator that we should pay attention to. Stomach aches, headaches, avoidance of activity, showing that they're feeling ill, but not really being able to place what's going on is an indicator that something else needs to be, discussed with the child, be able to really uncover what's going on with them. As well as things like bedwetting. Regression of developmental milestones is a big warning factor. As mental health professionals, we may ask about, when was the first time they hit certain developmental milestones, especially for individuals that don't have that vocabulary to tell you that something is wrong. Being able to notice if they're not, having their same friend group, having their typical ability to get ready in the morning, eating, like those are things that kids typically have a structure for in their day to day, that if you're seeing major changes there, that should be red alarms going off for caregivers, for mental health professionals, continuing to ask those questions when you're meeting with the children you work with, the youth, and students is really important. Clinginess and separation anxiety. Any sort of anxiety that we're seeing is an indicator for probably needing a higher level of support, not wanting to be away from mom or dad, not wanting to leave their preferred teacher or mental health professional in the school. There's typically some sort of bond that they have created with that person, and that can be very, very difficult. We also know that teachers change every year. Our favorite counselor may not be at the school any longer. There's changes in our workplace. Being able to recognize that the shifts of what we consider to be systematic changes are probably going to impact a child like this, and being able to have a plan for how to support them during those transitions is really important. Angry outbursts and hyperactivity are both warning signs. A child that has frequent tantrums, a child that's not able to regulate in the classroom, whether that be, destructive behavior or not being able to sit in their seat. Usually that's a warning sign that they are having something going on with them. Obviously, all of these things could be warning signs for a lot. Being able to start that conversation with these warning signs being at the forefront of that screening that we can do is the important part. Um, and then, of course, indirect references to death or disappearing. This could really be talking about it. This could be drawing something. This could be, acting out something on the playground. That can show up in a lot of ways for younger kids. A lot of times it's their play that can indicate that something more is going on. With adolescents, we see this kind of in a little bit different of a presentation. So here's some examples that we have. So obviously withdraw from friend groups. It's a really important social time for adolescents in middle of the high school to post high school time. So if we're seeing changes in how they show up in their social circles, that is an indication that something is a conversation needs to be had. Um, we see some adolescents struggle with social connections and have trouble even broaching friendships versus some that have friendships and start to withdraw. So understanding where the child is at, we know that bullying happens both in person and online now. Social media has such an impact on mental health for adolescents at this point that withdrawal could look like both virtually and in person withdrawal from their typical patterns. We are seeing an increase of substance use and dangerous behaviors. This can be everything from skipping school to using substances to drinking. We're really seeing across the board risky behavior. And this may increase over time that mental health difficulties are occurring. This is a really big warning sign to put into place interventions for that child or student. Giving away meaningful possessions for those that things that they care about is something that should be alarm bells. I find that a lot of times youth are the ones that report their friends having these type of difficulties and bring it to an educator, bring it to the counselor at school. They know a lot of times what's happening more so than the adults do. And so this even goes back to that myth that we talked about a few minutes ago about being able to have the youth know about what is suicide prevention, and open those conversations. More times than not, they may be the ones that are actually reporting things like giving away meaningful possessions or changes in their peers' behaviors. And of course, academic decline. There's persistent hopelessness, not being able to engage in school, not showing up to school as all warning signs for adolescents that may be struggling. All right, I want to open it up here for anyone to unmute, talk about some of the warning signs that they have seen with youth and either their own experience at work as a mental health professional. What warning signs have come up for you?
Feel free to just unmute and jump in.
Hey Jenny, this is Christine Crone. Under the adolescence category, I was wondering if like another risk factor would be like I don't know how to put it, but like risky sexual behavior, I suppose. Yeah.
Absolutely. Yes. And even engaging online with behaviors is something that will come up, engaging with risky behaviors with peers as well as older individuals will come up. It's parents a lot of times don't know what's going on behind the scenes, and there's a lot of monitoring that is difficult for those type of behaviors. But absolutely, that is 100% a warning sign. What do others see?
Hi, good morning. This is Jackie. I know we see a lot of either writings or drawings, such as either, drawing pictures that kind of represent self-harm, but sometimes with humor, or just making statements to friends about either directly, I wish I were dead, or I wish I wasn't here anymore. Unfortunately, when we get those statements or drawings, we're having to do a lot of suicidal assessments, even if afterwards they're determined to be a low risk. But most of what we've been following up on is either verbal statements or drawings.
Absolutely. Thanks, Jackie. I think it's across the board. Some of those drawings, get turned in or by a friend or seen in a classroom or brought home, and it can definitely be alarming. But I think one thing to call out is that risk assessment is really important to understand what is the risk level and what is the type of intervention needed. And so just because we're talking about I want to die or drawing something that is concerning, it sends off alarm bells so that way we can intervene and better understand what the risk level is and then continue to provide intervention to help support that individual. Awesome. Any others? Any other warning signs that have come up in your practice?
I just remember one more just very quickly, because we're in the school setting, sometimes responses to seemingly very writing prompts in class, especially during a lot of our reading language arts classes. Sometimes they may be in response to the writing prompts that are provided in the journals. That's where I've been called to intervene as well in response to those prompts.
Absolutely. I think there's a lot more social emotional engagement in schools now too that allow for hopefully skill building, but also identification. I've seen many school systems have even moved towards universal screeners as a way to be able to pick up on some of those warning signs sooner and get a screener out to all students.
You're covering it later in your presentation, that's fine, but could you talk about what kind of screeners
Yeah,
that
definitely.
we use?
Yeah, so really depends on the school system. Some are, I've worked with a lot of states. Some are like a pediatric symptom questionnaire, the PSC-17. Others may be a PHQ-9 and a GAD-7, so anxiety and depression scales. Others have more nuanced and unique screeners that they use with specifics on substance use, suicidal ideations, anxiety, depression, ADHD. Some schools are working with specific companies that provide both those screeners and the social emotional learning as a combined package. And so it is most recommended, obviously, to have the mental health teams work together with the school administration to kick off things like universal screeners. Not talking about these things typically leads to more severe problems that are coming up. And so I think depending on how much the school is feeling equipped to manage what comes out of universal screeners, we've seen varying levels of desire to do universal screeners. A lot of times we hear that school systems don't feel like they have are equipped with the resources to address what they're actually getting out of the answers on these, especially when it comes to suicidal ideations. And so it offers a really unique situation in which there's kind of this back and forth between the systems and administrative aspects of it and the true mental health, positives of being able to ask these type of questions. Have you all seen this conversation come up in your school system? Since it seems like many are here from our school systems. Mhm. What has been the general consensus that your school system is landing on right now? Not sure. Yeah. I think with technology increasing right now and being able to do things like screeners, school systems are kind of teetering back and forth about whether they want to approach something like that. But um, it's one of those things, you open a can of worms and not know how to manage it, or is there a bigger risk by not asking these questions? And I think we're seeing a big divide within school systems across the country for being able to ask questions like these. Um, yeah, will resources be in place? I mean, we know school-based mental health is already a huge challenge right now. And being able to have school staff in place when there is a more in-depth risk assessment that's needed. And many school systems have a very like rigid procedure to have these in place. Um, for those on the call who are in school systems, do any use the Maryland Action Plan to Prevent Suicide, the MAPS? That's a great question. Does anyone use MAPS in their school system? Christine, do you want to say a few words about what MAPS is and how your school system uses it?
So I'm more coming from a physician perspective, but it's the last few years, um, it's all falling on the school system. Not, physicians do screening, but a lot of it is trying to create awareness in school systems. Not totally familiar with MAPS. I just kind of came across it the other day, but I think it was released in 2024, and it's a comprehensive reference guide that aims to equip K through 12 public and private school communities with tools and effective suicide prevention and intervention. I'm
Great.
not totally familiar with it myself. I just have been meaning to reach out to MDH to see how many school systems are using this.
Yeah, I think that it's an increasing priority within Maryland school systems and has been put onto a lot of the priority markers that the administration is tracking, and being able to have the right resources there goes hand in hand with it. Lily Braun said we're using the signs of suicide prevention education, but don't think that screenings are being done at this time. So I think there are quite a few tools out there for screening. Understanding how we're managing it could be the barrier here, but it sounds like there's an increasing, body of work within Maryland to be able to address what's going on there. And I think that really ties into some of the statistics that are coming up. Each school system actually reports out on these measures during their school year, and each county is putting out what their needs assessments are to be able to address mental health. Maryland has a full blueprint that they have on being able to address mental health, with funding going into consortium grants to be able to help support mental health. Many of you may be involved in the consortium, the CHRC, which is providing funding for the school system to have additional resources there to really address what's going on. 52% rate increase between 2000 and 2021. We know post-pandemic that has even increased further. And I think even 22% of students at risk, it's higher than that now. That's back in 2021, some of the statistics. And so we're seeing this become more and more part of the conversation, and it being the second leading cause of deaths for 10 to 24-year-olds. And so It's not a problem that's going away. In fact, it's continuing to increase, and we know that the resources that go alongside it need to also increase. School systems are moving towards school-based mental health with community providers coming in to provide services, as well as utilizing mental health practitioners within the surrounding area for in-person and virtual care. We know that it's difficult to manage some of these crises if you're not right there with the individual that you're treating. But we're having to increase the amount of clinicians that are able to help support and equip our professionals and our educators with tools for how to actually screen for this and act upon it. If you haven't taken things like youth mental health first aid and, some of the other evidence-based practices, it could be a really positive additional training for those that maybe don't have, a mental health background. So if you're in a school system and want to provide additional resources for educators, administrators, that is a great way to have some basic additional training and certifications. When we look at how to actually respond, school systems obviously have a protocol typically in place, and talking with the student support teams or the mental health team within the school is the way that you would be able to find out what that policy is. Really, it's at the core of what we're doing is that risk assessment. But first, we have to ask. We have to directly inquire about suicidal thoughts with care and concern. We'll talk about some of the scripts that we can use for that. But asking directly, sitting down and having a conversation is part of that 5-step framework to really ensure that we're getting to the bottom of what's going on. We want to keep that student, child, we want to keep them safe, removing those immediate dangers and ensuring their physical safety. When we're doing a risk assessment and asking, are there any means of obtaining weapons or things that would cause harm, it's really important to talk through whether that's knives, guns, pills, medication. There's a list of things that will be really necessary to adapt within an environment to make sure that they are physically safe. And asking those direct questions about, do you have a plan? What is the plan? Are really needed in order to be able to keep that immediate environment safe. A lot of us are caregivers, pediatricians, physicians, educators. We want to ensure that all settings are safe too. And so connecting in with parents immediately when these things are coming up is extremely important. Talking with teachers, who else is in that treatment team, in order to make sure that across all of the settings that the individual is in, that we're thinking about, immediate safety and supervision. Helping to connect. So obviously, there's acute needs in which we can do a risk assessment. We can say you need to go to the ER. We need to, get you into, an inpatient or intensive outpatient type of resource. There's also ongoing needs. We know that after an acute crisis, we still need to be following up with mental health professionals and having that continued treatment to really get to the bottom of what is going on and why we're having these type of symptoms or ideations. And so linking them to mental health professionals is extremely important so that they can continue that treatment post stabilization from a crisis. And that can look a few different ways. Intensive outpatient programs are great to, have a step down from any inpatient care or emergency room visits. They're meant to be short term, maybe a couple weeks, sometimes a little bit longer. They can be both virtual and in person. Being able to then transition to a regular outpatient clinic is necessary. So that could be an in-person or virtual outpatient provider. Maybe it's a school-based mental health clinician wanting to continue having them engage and also providing those resources for caregivers. We know that it's scary to have a student come and tell you that they want to kill themselves or have another crisis. And just like our, blood pressure can go up and we want to make sure we're doing everything in line, parents also have that same need to help support them through that process and give them information on what do you do and how do you handle it. Ongoing emotional support and consistent presence are necessary, not just for safety and supervision, but also to open up the door for talking about what's going on. Having those open conversations where it's non-judgmental, where, not saying, well, you're being dramatic or like, I think you're fine. It could be a lot worse. Those type of things are kind of shutting down that conversation. And so we want to keep an open space for the language that we're using so that the student or child is still engaging with us and offer that safe place for them to discuss what is going on, and be able to keep our ears out for those continued potential warning signs. Regular check-ins, continued support. The more planning that can occur, the better. Safety plans are not just about eliminating risk to access to weapons or harm within their immediate area. It's ongoing support that's really necessary. A detailed plan, like we're going to check in every morning when you come in, you're going to go to a lunch bunch group or a lunch and learn or a check-in place after fourth period. The parent's going to ensure that they have a touch point right after school. Those very finite plans as a child is expressing that they need additional support are necessary. And creating what that routine looks like for the check-ins is extremely helpful. This could be things like a mood tracker. It could be a space to draw pictures and paint. It could be scheduled time before sports practice to sit down and have intentional talks about what's going on. At home, it may be, after dinner, let's go ahead and check in about how our day went. How are we feeling? What are your goals for this week for your mental health? A lot of times we get swept up in we've got to do homework and get ready for bed and sports. Being able to have intentional time about how are you feeling? What's going on is extremely helpful for that child to just have a moment to sit and think about how am I feeling? What is my self-reflection from my day? All right. Any questions or thoughts about the 5-step response framework? Have you all used something like this? Maybe it was called something different. All right. Well, hopefully helpful information when you think about how do you, go step by step through your actions. Here's a little bit of language information about what to say. Validating feelings and experiences, extremely important. It's not just a phase. Every ideation, every verbalization should be taken seriously. If we're starting to say, well, this is just a behavior, they just want to get out of school, they don't want to, do these type of things, it becomes really difficult to listen with that empathy, to talk with them, to show up non-judgmental when we have a conclusion about why they're doing this. If a child is acting out, there is a reason for it. It's not typical for a student to just want to be bad and be labeled bad. It's something else going on. And so we take everything seriously. And especially as mental health professionals, we don't have the option to not take it seriously. Working with caregivers to understand that this is what they said, we need to talk through it. There's something going on is extremely important. Oh, Jackie used that as part of the suicide risk assessment. Wonderful. Taking a moment to offer that consistent presence, to show up, to do that check-in is helpful. I'm glad you told me your feelings really do matter. I'm here to support you. Let's talk. Let's sit down. How can we, talk through this? Do you want a moment to journal, write your feelings down, draw your feelings out? That genuine empathy and concern is usually how we open the door to understanding more about what that child or student is going through. Judging and criticizing comparison to others, promises to keep it a secret or not tell their parents, leaving them alone. Those are all big don'ts. I find that especially with adolescents, don't tell my parents is the first thing that comes out of their mouth. They want control over their situation. And when something like a suicidal ideation comes up, the first thing we know we have to do is loop in the parents. I find that involving them in that process helps them feel more in control, even if they don't want to tell their parents about what's going on. An option of, I need to let your parents know, you know, that that's a priority for your safety. I care about you being safe. Do you want to tell them with me? We can talk about how we can tell them. That is a way to give control back to an adolescent that may be encountering challenges with their mental health. Parents are extremely important in that process, and also being able to understand that the parents may not respond in the way that we want them to respond. It's about giving them psychoeducation and bringing them into the loop about these things as well. And hopefully information like this helps all caregivers to better understand what it means to have suicidal ideations. Any other language that you all use when it comes to talking with a student or child that's expressing suicidal ideations?
Jenny, not so much language, but just reiterating for a don't, it is not attention seeking. Oftentimes, people will think, oh, they're just trying to get attention. We never just assume it's for attention seeking.
Absolutely. I think it's one of the biggest misconceptions that like coaching people on is it's always a concern. Creating a safe space may come into this too. This is not a hallway conversation. This is not a in passing conversation. It's intentional, sit down, safe space, giving time. Um, Opening up about how you're feeling can be really difficult and scary. And so giving space to ask a question and give a little bit of air. You don't have to fill the space is important. It allows them to have a moment. Even seeing some students, I'll say, you don't want to tell me, write it down on your paper. And after they get those thoughts down, follow-up question of, why don't you tell me what you wrote? Tell me part of it, some of it. What do you want to share? And they've now had a second to formulate the words and think about how they're feeling. And it's easier to get out of our mouth then once we have something down on paper. Right. I want to be mindful of time. So I do have a few other things, but I wanted to go through one case scenario with everyone to give a little bit of opportunity to put this into practice. And then we can talk about a few other of the tools. So we'll just take a couple of minutes here to talk about Maya's story. She used to love going to art class and spending time with friends. Recently, she's been isolating herself, saying none of it matters anyway. Her sleep is irregular. She's skipping meals. She gave away her beloved sketchbook. She just said, I don't need it anymore. So coming from your point of view as a parent, as an educator, administrator, pediatrician, physician, mental health professional, what warning signs do you notice here? There's probably some screaming red alarms to you all. Pop in a chat, come off mute. What warning signs do you see? Awesome. Jackie said isolation, changing routines, and giving away treasured objects.
What she specifically said, which is none of it matters.
Yeah, that's one of those somewhat vague, like, type of statements, but really important. Anything else we see?
Especially in the context of the other behaviors.
Absolutely. It's not just one thing in isolation, it's all of the factors together that build on each other. So lots of interest in things she loves to do, not hanging out with friends, plus not eating. None of it matters anyway. You're seeing 4, 5, 6 of these warning signs start to stack on top of each other. What questions would you ask Maya? What would you say to her?
Why are you giving your things away? Or why do you feel that it doesn't matter?
Absolutely. Direct, simple, to the point. Any other approaches? I think my phrase is I'm noticing. Yeah, first recognizing that she's no longer engaged in class. I've noticed statements. Yep, that's such a good one. I'm noticing that you're not interested in art. You're having trouble with isolation. You're skipping meals. Why don't you tell me a little bit about what's going on? I'm concerned about you. Any others? How soon do you call a parent when you're noticing these things? Right away. Are you doing a risk assessment?
Yes.
Mm-hmm.
Yeah.
Definitely. Great. Sometimes just asking those questions, you want to know, what's going on and spending that time. Are there any other strategies that you might use to help a child that maybe is having trouble opening up?
Well, since she loves art, I don't know what Maya's age is, but I may want to have her draw something or create something that could help gain
Mm-hmm.
more insight as to what's going on with her and how she's feeling.
I love it. This is why we play games in therapy a lot of times, right? Like Uno is not the point, and drawing is not necessarily the point, although it helps to kind of channel what we're doing with our brain and eyes and hands. Katie, yes, another safe person in the building. Figuring out who matters in Maya's life, like who does Maya trust? It could be a friend, right? It could be a peer that might help her. Other things? All right. I had a couple more stories, but we're gonna skip through here. But you all did have the immediate response. Do a risk assessment, talk with them, intervene right away. Don't let those things sit and see how do they turn out in a couple of weeks. Now is the time to act. Absolutely. Building resilience is something that is a skill. We even know as adults, resilience is really difficult. You get knocked down 10 times. How many times do you get up? Supportive relationships is a big piece of it. We know when we're feeling down, we surround ourselves by the people or the things that really build us back up. Having those relationships preemptively with students, offering spaces within families to really have that caring relationship as a preventative factor. We all might look at protective factors and risk factors as part of our assessments. What are those protective factors, but how do we also build them preemptively? It's healthy for us to have supportive adults in our surrounding, mentors, those that are helping prop us up, and then peer connections. Who are our friendships? How do our friendships operate? Are they healthy? How do we teach what healthy friendships are? Those social supports may be the ones that help a child stay connected and safe and reach out when they need support and have people notice if they do need more help. And of course, community. We know that community has changed a lot in the years. You used to have neighborhoods where everybody knew everybody and, it takes a village and it doesn't always seem like that now. And so that community may be online. It may be, in specific pockets or religious communities or certain cultural customs that people are doing. So understanding what does community look like for our students, for our children, for our patients, that is important to understand. Do they, have that network around them, really helping to keep eyes and notice what's going on with them. Obviously, like they may or may not have all these things. There's trauma, there's increasing crime, there's adversity that kids are going through. And so you're not going to have a 100% perfect profile and all protective factors and no risk factors. It's about how do you rely on what is there, build what is there, and mitigate any risk that there is, because you're never going to have no risk. That's not the world that we live in. It's about how do you really build upon those protective factors that we do have. It's an ongoing process, not just a one-time checklist that we might be doing. It's a really ongoing effort that we have to make. I'm sure coping toolboxes come up quite a bit, so I'll just take a second here, really being able to provide social emotional support, skill building strategies. These are things that are helpful when talking about ongoing healthy habits that we're doing, whether that be, box breathing and grounding techniques, physical activity, other, hobbies and healthy habits that they're doing, routines that they put into their day-to-day life, being able to have not just one, but a handful of things that we do in the moments that we are needing support is extremely helpful to, being able to have options in those moments. Obviously, listen with compassion. We've talked through most of these things, so I want to skip ahead to what can you do tonight? Whether this is from an educator, a physician, mental health professional, or caregiver point of view, being able to normalize the mental health talk, I want to stress is extremely important. It's difficult, uncomfortable at times. The more that you practice it, the easier it becomes to at least ask the questions, but you're always going to have to be open to what the answer is and feeling comfortable when we know that we have to take action. It comes with time. It doesn't necessarily get easier, but we start to understand what to do and build those connections that are really helpful for being able to have life-saving measures sometimes. It's okay to feel overwhelmed. Grounding yourself in that 5-step, the risk assessments, the procedures that you have laid out, coming in with a plan in the event that something does come up. Presence over perfection. I say, even in this talk, I don't say everything correctly, and I will give that caveat that I might say it wrong. Feel free to correct me. It may not come out right. It may not be what you needed to hear, but it might get you to what you do need to talk about, how you need to hear it to start to make some progress for your own mental health. So I don't always have all the answers. None of us do, but we're here to help. We're here to be a partner with you. A few resources. I did want to make sure that everyone is aware of 988, the Suicide and Crisis Lifeline, crisis text line. Our adolescents do prefer to text sometimes. So 741 is a great resource. The Trevor Project, looking at LGBT populations and being able to help support them because they are disproportionately impacted by suicide. Obviously, Backpack Healthcare is the company that I work with, and being able to address suicidal ideations, depression, anxiety across the board. And then, of course, other organizations, NAMI, Mental Health America, are really important to ensuring that we continue to have all of the different resources that we need around us. So with that, I want to open up for any questions. And definitely in the chat, unmute, Hopefully this was helpful to share, connect, talk about resources. Thank you, Katie, for putting in resources here as well. The mental health first aid course is fabulous. I actually just had some of our peer recovery specialists go to this course, and really, really find that it's helpful to provide some additional resources and support. And with that, any final questions, feel free to jump in.
Well, if no final questions, thank you, Jenny, and to Backpack Healthcare. And thank you for mentioning, we put in the chat too, Mental Health Association of Maryland offers mental health first aid, youth mental health first aid, as well as QPR, question, persuade, refer, suicide prevention. So again, Jenny, thank you for this valuable information in this month, Suicide Prevention Month. So a lot of good information here. We will be sharing these slides, so make sure you get these and share with your colleagues. If you want more information about Backpack, you can reach them at hellobackpack.com or email them at support@hellobackpack.com. Thank you to all of you for joining us today as well. You will receive an email with a link to the recording, the slides, and a survey asking for your feedback so we can continually improve these webinars for you. Join us for our next webinar, October 16th, 11:30 to 12:30, for Enhancing Parent Engagement for the New School Year, hosted by Parents Place of Maryland. We're in the planning stages for the 2026 Children's Mental Health Matters campaign, but you can still sign up now and be a champion and a mental health advocate all year round. You'll be growing a network of Marylanders advocating for the mental well-being of children in communities across the state. We look forward to working with all of you to support our families and communities. If you have any questions, feel free to reach out to us at info@cmhm.mhamd.org. So thank you to all of you. Thank you again, Jenny, and we hope to see you next month. Have a good rest of your week and weekend.